External genitalia. Synonyms. Vulva, pudendum. The vulva or pudendum includes all the visible external genital organs in the perineum. Vulva consists of the following: the mons pubis, labia majora, labia minora, hymen, clitoris, vestibule, urethra and skenes. Glands. Bartholin's glands and vestibular bulbs. Fig. 1.1. It is therefore bounded anteriorly by mons pubis, posteriorly by the rectum, laterally by the genitocrural fold. The vulvar area is covered by keratinized, stratified squamous epithelium. Mons veneris, mons pubis. It is the pad of subcutaneous adipose connective tissue lying in front of the pubis and in the adult female is covered by hair. The hair pattern, escutcheon, of most women is triangular, with the base directed upwards. Labia majora. The vulva is bounded on each side by the elevation of skin and subcutaneous tissue which form the labia majora. They are continuous where they join medially to form the posterior commissure in front of the anus. The skin on the outer convex surface is pigmented and covered with hair follicle. The thin skin on the inner surface has sebaceous glands but no hair follicle. The labia majora are covered with squamous epithelium and contain sweat glands. Beneath the skin, there is dense connective tissue and adipose tissue. The adipose tissue is richly supplied with venous plexus which may produce hematoma, if injured during childbirth. The labia majora are homologous to the scrotum in the male. The round ligament terminates at its upper border. Labia minora. They are two thin folds of skin, devoid of fat, on either side just within the labia majora. Except in the Paris women, they are exposed only when the labia majora are separated. Anteriorly, they divide to enclose the clitoris and unite with each other in front and behind the clitoris to form the prepuce and frenulum respectively. The lower portion of the labia minora fuses across the midline to form a fold of skin known as fourchette. It is usually lacerated during childbirth. Between the fourchette and the vaginal orifice is the fossa navicularis. The labia minora contain no hair follicles or sweat glands. The folds contain connective tissues, numerous sebaceous glands, erectile muscle fibers and numerous vessels and nerve endings. The labia minora are homologous to the penile urethra and part of the skin of penis in males. Clitoris. It is a small cylindrical erectile body, measuring about 1.5-2 cm situated in the most anterior part of the vulva. It consists of a glans, a body and two crura. The clitoris consists of two cylindrical corpora. Cavernosa, erectile tissue. The glans is covered by squamous epithelium and is richly supplied with nerves. The vessels of the clitoris are connected with the vestibular bulb and are liable to be injured during childbirth. Clitoris is homologous to the penis in the male but it differs in being entirely separate from the urethra. It is attached to the undersurface of the symphysis pubis by the suspensory ligament. Vestibule. It is a triangular space bounded anteriorly by the clitoris, posteriorly by the fourchette and on either side by labia minora. There are 4 openings into the vestibule. A urethral opening. The opening is situated in the midline just in front of the vaginal orifice about 1-1.5